How exercise helps prevent and manage type 2 diabetes. Improve blood sugar levels and insulin health and mediate complications from type 2 diabetes with these tips from endocrinologists and exercise physiologists. Strength training, also known as resistance training, improves insulin health, so don't forget to include it in your exercise routine. If you're working to manage type 2 diabetes or trying to prevent the condition altogether, exercise is a crucial step in making your goal a reality. The long-term benefits of exercise on blood sugar and insulin health are unquestionable, says Rosa Kozlowskaite, MD, Associate Professor of Endocrinology, Diabetes, and Metabolism at Rush University Medical Center in Chicago. For example, a review published in March 2020 in Mayo Clinic Proceedings found that in people with type 2 diabetes, regular exercise can reduce dependence on glucose-lowering oral medications and insulin. And according to a study published in November 2015 in The Lancet, increased physical activity can help reverse prediabetes, which the Centers for Disease Control and Prevention notes affects more than 1 in 3 adults in the United States. According to the American Diabetes Association, adults with type 2 diabetes should perform at least 150 minutes of moderate to vigorous intensity physical activity per week or 30 minutes 5 times a week. Research shows that performing both aerobic, also known as cardiovascular, exercise and strength training is far more beneficial at improving insulin health than either type of exercise alone, explains Nick Okipinti, CSCS, an exercise physiologist based in Red Bank, New Jersey. Exercise helps manage prediabetes and type 2 diabetes by lowering blood glucose levels and improving insulin sensitivity throughout the body. Improving weight loss. Losing just 5 to 10% of your body weight can improve your A1C, which is the 2 to 3 month average of your blood sugar levels, according to Johns Hopkins Medicine. Reducing visceral fat. Abdominal fat, also called visceral fat, is a major player in the development of insulin resistance and type 2 diabetes. These fat cells not only store energy but they can produce and release a host of chemicals and hormones that make it harder for the body to use insulin, worsening insulin resistance, Okipinti says. When trying to lose belly fat, research suggests that resistance training is the most beneficial form of exercise in people with insulin resistance. Apart from managing blood sugar and insulin levels, exercise functions to slow, stop, and in some cases, even reverse the long-term effects that occur due to the progression of type 2 diabetes. Improving vascular health. When you exercise, your muscles release a host of compounds that benefit vascular and circulatory health, Okipinti says. That means more oxygen and nutrients can get where they need to go, reducing the risk of diabetes-related neuropathy, vision loss, and heart issues. Improved blood flow may also aid in joint health, he explains. Yet routine exercise can help lower chronically high inflammation levels to mitigate its detrimental effects, Okipinti explains. Improving cholesterol and blood pressure. Apart from strengthening heart health through improvements in blood flow and reductions in inflammation, exercise also targets blood pressure and cholesterol levels, Okipinti says. Restoring nerve function. In one study, men and women significantly reduced diabetes-related pain and neuropathy in just 10 weeks of exercise. Researchers note that during the course of the study, nerve health and function also improved. Boosting joint health. Diabetes-related joint pain and mobility limitations such as frozen shoulder are common complications of insulin resistance, says Ankush Gupta, MBBS, a diabetologist based in Pune, India. This will help you ensure that you're choosing a form of exercise that is best suited for any coexisting health conditions that you may have, such as heart disease or diabetic neuropathy. Dedicated workouts are great, but including everyday activity and physical recreation is equally, if not more, Important, Lachlan says. Performing everyday physical activities like walking while doing your errands, taking out the trash, and cleaning the house also helps maintain functional strength and mobility. When it comes to resistance training, multi-joint exercises such as squats, lunges, rows, and chest presses come with the greatest per rep benefits for both blood sugar management and the progression of related complications, says Okipinti. Adding medication to your treatment plan can help lower your blood sugar levels, but you may need to change some daily lifestyle habits, too. Thank you for watching. Don't forget to subscribe.